I've learned much pretty interesting things. So my question is some way technical.
Okay.
I want to go to the slide in which you showed the probability functions for the parameter estimates.
Yeah.
Yeah, thank you.
Like this, or?
Yeah. So what I want to know here is do you used a Bayesian approach here?
Yeah.
Yeah. Okay. So which prayers you used here?
The priors are quite wide. I don't put them because I don't exactly know how to present that information, because it's just a table with the priors. But for example, the priors for the probability of transmission per contact, it's like uniform between 0 and 1, because it's a number that can be between 0 and 1, for example. The prior, for example, for the reduction probability of transmission per contact, I think it was Gaussian around 0, because we would expect, it's a prior information, so we would expect that our contact structure after the lockdown that was collected, that it actually describes the pandemic after the lockdown, because that was the our prior belief. And we see that we estimated a bit lower. That's one of the things that we found out, actually. If you would just use that contact matrix after the lockdown, that doesn't work. For the latent period, we used, the prior was like a wide range. It was, I think we used the prior for exactly for 1 over gamma, so that 99% of the mass lies between 1 and 5 days, I think, if I'm not mistaken. Yeah, it's between 1 and 5 days. And for the prior, for the infectious period was even wider. It's something, because the infectious period is estimated to be, it can be longer than the latent period, but not too long also, because at the same time, when we estimate, the measures were already introduced. And for example, the requirement to self-isolate when you have symptoms, it effectively reduces the infectious period in the population, because people don't just walk around keeping on infecting others. So here the prior was, I think, between, I think it was up until 15 days. So 99% of the probability mass was between 1 and 15 days. Or 14 days.
Yeah, thank you. So because I'm working on a study like this one, what I found in the literature that a study that tests many important, a wide variety of priors, and fixed the log normal density prior for the transmission rate and for recovery rate. So I think I have to explore much more literature papers to look for something like what you have just said. So excuse me, I have something other to say. When you are interested in the posterior distribution of the incubation period, you have to condition on the exposed individuals or on the data. So you need to have some data on exposed individuals that are unrecorded or unreported. So have you filed in this? Have you touched this task in your study, or how do you handle this problem?
In our, for the prior, we include the requirement that, for example, the latent period, our latent period, it has to be shorter than incubation period, because incubation period is time between the infection and the symptoms. And because SARS-CoV-2 can be transmitted before the symptoms appear, so there is pre-symptomatic transmission. So the latent period, the upper bound on the latent period, it has to be shorter. Moreover, we have another constraint is that the sum of the two of the latent period and this infectious period, so the average, so if you add up like 2.5 plus 4.8, it has to be equal to the serial interval. So that's the time between, So that's what we use, but we don't use any other data apart from what I reported.
Okay. Thank you very much for your response. Thank you, Mayra.
Ganna, we have two questions on the chat. So from Andrea Pugliese, you assumed some susceptibility 0 to 20 years. Other studies assume lower susceptibility for 0 to 10 than 11-20. Would that change our results?
I think, Andrea, thanks for your question. And I guess Miriam Kretschmer would send you greetings if she knew that you are joining. I think we could have introduced this. Initially, our partitioning for the susceptibility of different age groups, it was determined by the studies where we could use exactly the prior information for our model, which used exactly the same partitioning. So there is a review by Mark Lipsig where they look at, 10 or 15 studies where the susceptibility was estimated for different age groups. And sometimes people use, 0 to 4 or 4 to 12-year-old because that's how the school years are divided and so on. But we use the study which had exactly the same categories as we do. I'm pretty sure if you would introduce further partitioning within the 0 to 20-year-olds group, we would also have different susceptibilities and lower in very young children and a bit higher in the older children. But we thought it's more robust to just first show that, for children overall or for younger people, the susceptibility is lower than for adults, and for adults it's lower than for elderly, at least based on our model.
Okay, and the last question, so you can move forward, Ganna, from Russell Alpjahara. How population density and school sizes may impact your results?
I think it's a really primitive work, as I say. Density of school sizes. I mean, if the population density, it probably determines how we introduce we use just the mass action in our model. So it's, as you can see, and we do this because the Netherlands is a pretty densely connected population. So I will go back to the equations. So here it's a mass action where we have the susceptible that multiplies lambda, which is the force of infection, and that's the force of infection. And we do this because we have a densely connected population in the Netherlands. So I think if you use a very densely connected population, that should be roughly okay. But if you use a sparsely populated like country or location or so, you might need to use other approaches. I don't think that this would be right. And the school sizes, if the number of contacts, if the school is bigger, but the number of contacts that the children make within school per day is still roughly the same, I think it should still be the same. But if you have a bigger school, it means that you have bigger student classes, for example, and so the students would have more contacts, then I think the impact of schools could be larger overall. That's the conclusion. So if means bigger schools, more contacts, that means that schools would be more important. Yeah. Oh, it's nice. I see that you understood.
Yeah, he just answered many thanks. And okay, so you can move now. There is another question here in the chat from Silvia Vitali. Can be used to repeat the study for the second wave to validate the results?
Oh yeah, I think I think for the third wave, because in the Netherlands it's already third wave going on, or At least it's a lone wave. In principle, yes, I think it would be nice, but it's, I feel like we are always lagging a bit behind, because now, for example, we have already vaccination is going on and so on. So you can't just use this model. It needs to be extended, and you need much longer period of data. And yeah, we have a few people, few modelers who work, but we are not as big group overall as like Imperial College or London School, so where they have more people. So it would be nice. I don't think that we will do that. But for the Portugal, we are indeed doing more work and so on. So that will be ongoing.
Okay, so now Ganna finish her talk, and then we open a session again for discussion after her and her presentation.
Did you like the content of this channel? So please subscribe to the channel. It's quite simple. You just have to hit subscribe, and you can decide which level of the notification you want. You may choose all the notification, which means that everything that I do, you receive a notification on your bell here on the upper corner, or you can choose no notification. I would strongly recommend you to subscribe, even if you don't want to receive all the notifications. Just hit here, no notification, or hit the one that you like the most. It's pretty important that you subscribe to the channel, so I can achieve a high number of subscribers, and people can as well understand that this channel has a nice content to offer, and YouTube will understand as well that it can make a nice divulgation of the channel. So please subscribe to the channel.